heard the word Parkinson's, but what about the term Parkinsonism? Sometimes a doctor might say a person has Parkinsonism, but what does that mean? Is Parkinsonism the same as Parkinson's? Sort of. Let me explain. Parkinsonism is a general term that describes a group of symptoms: tremor, slowness, stiffness, and walking and balance problems. These are the core movement symptoms of Parkinson's, the ones we doctors use to diagnose the disease. Parkinson's is one type of Parkinsonism. It's also the most common, but there are many others. Here are a few examples. There's drug-induced Parkinsonism, which is where long-term use of certain medications, like those for schizophrenia, bipolar disease, or severe depression, can lead to tremor, slowness, and stiffness, usually on both sides of the body. Or there's vascular Parkinsonism, which is when small strokes from high blood pressure, high cholesterol, or diabetes can cause trouble walking, slowness, and stiffness, mostly in the legs. And then there's atypical Parkinsonism, or Parkinson's plus. Let's talk a little bit more about this. Atypical Parkinsonism describes a group of conditions that cause tremor, slowness, and stiffness, and that worsen over time. So they have the typical symptoms of Parkinsonism, but they're atypical in some ways, which I'll talk more about. These conditions are dementia with Lewy bodies, multiple system atrophy, or MSA, progressive supranuclear palsy, or PSP, and corticobasal degeneration. These are different diseases, but they have a lot in common. Here are 5 things to know about atypical Parkinsonism. First, like Parkinson's, they decrease dopamine in the brain. That's what causes the tremor, slowness, and stiffness. Second, because they have the same movement symptoms as Parkinson's, they can look a lot like Parkinson's, especially early on. Some people are first diagnosed with Parkinson's or even just Parkinsonism, and the diagnosis changes as the disease changes. Third, they cause symptoms that aren't typical of Parkinson's or aren't typical of early Parkinson's. These could be things like falling backwards, low blood pressure, constipation, or memory and thinking problems. Many of these symptoms can happen in Parkinson's, but what's different in atypical Parkinsonism is that they happen early on within the first few years, and they happen to a significant degree. Fourth, Parkinson's medications don't usually work very well, or they stop working after a short time. So physical, occupational, and speech therapy are often the main treatments. And lastly, they progress faster than Parkinson's, often over years rather than decades. And as with Parkinson's, there isn't yet a proven way to slow or stop progression, but research in this area is ongoing. So if you have Parkinsonism, how do you figure out what exactly is causing it? Your doctor will ask you a lot of questions and probably do some tests. They'll ask about your medications, your symptoms, and how your symptoms change over time. They'll also often do brain imaging, like an MRI or a CT scan, to see if you have small strokes or other changes that might account for your symptoms. Sometimes they'll also do a specialized brain scan called a DAT scan, or dopamine transporter scan. This looks at the brain's dopamine system, so it can help separate conditions that impact dopamine from those that don't impact dopamine, like drug-induced or vascular Parkinsonism, which I mentioned earlier. Now remember, both Parkinson's and atypical Parkinsonism impact dopamine. So a DAT scan will be abnormal in all of these conditions and cannot separate between them. Newer tests, though, like spinal fluid or skin biopsy tests, may help separate some of these conditions. These tests look for the protein that clumps in Parkinson's, which is called alpha-synuclein. As of now, these tools are helping move research forward more quickly. and scientists are working to make them simpler, like a blood test, and also more informative, like showing how much protein there is and how it changes over time. These tools will, hopefully, help us move toward earlier, more accurate diagnosis of Parkinson's and Parkinsonisms. And they'll help researchers better understand the similarities and differences between all of these conditions. So, back to where we started. Is Parkinson's the same as Parkinsonism? Now you know that Parkinson's is one cause of Parkinsonism, and that there are other conditions that can cause Parkinsonism too. For more on this and other topics in Parkinson's and related conditions, visit our website at michaeljfox.org/askthemd.